Senator Blackburn.
Thank you, Mr. Chairman, and thank you all for coming in. Let me give you an example of some of the problems Tennesseans are having with implementation on community care, which is something they really want. And I had one veteran from Chattanooga recently was giving me her story of trying to get community care for mental health services. And she was telling me how frustrating this was. And she likened it to going to the DMV and having a really bad experience and having to jump through all the hoops that were there. And finally, after meeting everything the VA made her do on community care, 8 months later, 8 months, she was able to see a mental health specialist in Chattanooga. This is so totally unacceptable. And it is as if the VA is trying to stonewall people and not let them into the community care program. Some of these individuals do not have someone that can take a day off work and drive them to a VA facility. And when they call, they're needing help then. Likewise, right now, and we check regularly to see how long the wait times are. If you wanted in Clarksville to go to a primary care physician, let's say you're sick and you call today and say you need to see someone in primary care at the VA, 28 days. In other places in the state, it's 74 days, 100 days to see somebody. So we have got to do something about allowing veterans to get to the care they need at a place where they are able to get the care. And that's the whole purpose of community care. And I've got a Veterans Healthcare Freedom Act that would create a pilot program that removes these requirements that a veteran has to get all this pre-authorization and jump through these referrals. And Dr. Elnahad, do you think that veterans can make these decisions on their own? Do you all trust them to make these decisions? Why are we getting these continual roadblocks? Is it the employees union that doesn't want this to work? What is the issue?
Well, Senator, the first thing I'll say is if the veteran isn't amenable and your office is amenable, we're happy to do everything we can for the veteran you just mentioned. That's an inexcusably long wait time. I agree. And
we have a
to
long
do better.
list of those.
Yeah.
That's just one.
And again, we are happy to review every single one and meet their needs. We have a patient advocacy office that can help us with that. More broadly, it is why the problems you are mentioning are exactly why I have identified the time to schedule veteran appointments in the community as one of the most important metrics we're tracking across the system. And where we are seeing deficiencies and inexcusably long wait times, we're honing in on trying to improve them and standardize those processes. We're also trying to expand the program that allows us to simply hand a veteran an authorization and a list of providers in the community that are in our network and empower that veteran to schedule the appointment themselves. Where we've tried this in certain areas of the country, Bedford, Massachusetts, VISN 19, we've seen success. We've seen that care coordinated
That
sooner.
is what veterans want.
Mm-hmm.
Well, let me ask you this. If that's your goal, is to say, here you go, here's a list. You know, if they call the VA, they can email that list back to them right then so they can call through. Then why did the VA take down the Mission Act website?
So I think, Senator, the website has the content that it's always had. The purpose of the update to the website was to offer a one-stop shop to veterans online to understand all of our programming, both internally within the VA and in the community. I am squarely focused, in addition to improving access to our direct care system, on making sure that the veteran experience through our community care program gets better and better. And again, we've identified that time to schedule, the coordination of care in the community as the most important things we have to improve, and you can be assured that I'm very focused on that.
Well, I would encourage you to try one of your pilot projects in Tennessee, because we could give you a list of stories like this, a list of people that are waiting, as I said, 30, 70, 100 days to see a primary care physician, a list of people that are waiting for oncology, and they're waiting months. So we would invite you to try one of these pilot projects in Tennessee. Thank you so much for being here today.
Thanks, Senator.